Hello everyone, I'm Zishan, and in this video I'll be talking about chronic obstructive pulmonary disease. So, as the name signifies, it's an obstructive disease in which there is problem in getting air out of the lung. So here you have the lung, and the air is not getting out of the lung. So here, air is getting accumulated here. It's not getting out of the lung. So, when we see these people's spirometry, what we see is that the forced expiratory volume in 1 second is greatly reduced, and the forced vital capacity, that's the total air that you exhale after a complete inspiration, forced vital capacity, even that is decreased. So what happens as you can see, this complete ratio has decreased. So I'll just give you an idea what this means is that let's say you are exhaling 5 liters of air forcefully out of your lung. Okay, the total air that you can get inside your lung is about 6 liters. So, and you cannot get that 1 liter out. It's about 1200 ml. Let's consider 1 liter. You cannot get that 1 liter out because that gonna remain inside your lung, and it's called residual volume. So the only air that you can get out is about this 5 liter, and out of this is given out forcefully, right? And out of this, normally 4 liters are getting out of the lung in 1 second. So this is your forced expiratory volume in 1 second, and this is your 5 liters. That is the forced vital capacity. So forced expiratory volume is about 80% of the total forced vital capacity, as we can see. It's about 80%, right? So this is the normal case. But when the person has chronic obstructive pulmonary disease, what happens is that the forced vital capacity that the person is going to expire forcefully is decreased. So it's about 4 liters, right? It's slightly decreased. And the forced expiratory volume in 1 second that you're going to give out has also decreased drastically. So that has decreased about by 2 liters, right? So here you can see the percentage of forced expiratory volume in 1 second is about 50% of the total air that you are going to expire, right? So that makes it 50% of the total forced vital capacity. And this is what happens in these patients in the chronic obstructive pulmonary disease. Normally, you expire about 4 liters of air in 1 second itself out of this 5 liter, but in chronic obstructive pulmonary disease, you expire about 2 liters of this decreased 4 liter. So this is giving you about 50% of the total volume that you're going to expire. What happens to that 1 liter? That's going to stay inside your lung, right? So now let's have a look at the types of chronic obstructive pulmonary diseases. Types. The first type is chronic bronchitis. Second is emphysema. Third is asthma. And the fourth is bronchitis. So out of these 4, we'll be discussing chronic bronchitis in this video, and the following topics we'll be discussing in the videos to come. So let's begin. Okay, so continuing with chronic bronchitis, we define chronic bronchitis as when a person has cough with expectoration, that is mucus production, for more than 3 months, and this goes on for at least 2 years. I hope you get that. The cough with expectoration for more than 3 months, and this episode lasts for at least 2 years or more. Fine. And there's increased mucus production, as I just told you. So this was the basic definition where I was highlighting the points to you. So looking at the pathophysiology, what happens is that, let me just introduce some terms to you. What happens is that we have serous acini the serous glands and the mucinous glands. Fine. So here I have drawn a basic diagram just to highlight the histology, right? So what we see here is the lumen. Then we have the pseudostratified ciliated columnar epithelium. They have cilia, they have columnar epithelium, they are columnar cells, and the nuclei are not just at the base. You can see them up and then down and then up and down. They are at different levels, right? So pseudostratified. Then we have the lamina propria here. I just name it lamina propria. Lamina propria, and which has blood vessel. Then here, this area is where we see the serous and the mucinous glands. So what's the function of serous and the mucinous glands? Serous glands produces serous secretion, which is a serous fluid which humidifies the air that we breathe in. Okay, so serous secretion, it's water fluid that will reach here and humidify the air that we breathe. The mucinous secretions, what will that do? They will produce mucus, which will trap the pollutants that are coming from outside, and that will help us get rid of them. So pathophysiology is simple. It's basically seen in people who are chronic smokers, because they will bring in lots and lots of pollutants inside their lungs, right? So inside there, basically the airway, right? So what's going to happen is the chronic smokers, because of this increased smoking, you will see increased pollutants getting into the lungs. That will lead to increased mucus production to get rid of those pollutants, right? So this will be basically seen as hypertrophy and hyperplasia. Hypertrophy is basically increase in size of the mucinous glands, and hyperplasia of the mucus glands, that is increase in number of the mucinous glands, right? And what will that do? That will basically create a very high chance of mucus plug formation in the bronchial tree, right? So this was the basic idea, and this mucus plug formation does a lot of things that we're going to see in complication, one of which is hypoxemia, which is one of the main causes, right? Okay, now coming onto the microscopy, we see that there is increase in Reed index. What is Reed index? Reed index is basically the area that is covered by the mucinous gland in the cross section that we see of the bronchial wall. The area that is covered by the mucinous gland is represented by the Reed index. Fine. Now this area out of the total area that we see is usually supposed to be normally less than 40%. Fine. Now this is about 40%. Now when that increases to more than 50%, we say the Reed index has increased more than 50%. Fine. As we can see here, the mucus glands have reached this area to this area to this area. Maybe they could even reach down. Okay, they could increase in number basically. And when they increase more than 50%, we say the Reed index has increased to more than 50%. Now talking about the symptoms that we'll see in the patient, there will be hypoxemia because of the mucus plug formation. Now this is I'm showing you the alveoli, and this could occur anywhere in the bronchial tree, right? So because of the mucus plug formation, there will be decreased partial pressure of oxygen here into the alveoli. Why? Because of the decreased oxygen coming in, because the oxygen will not be able to come in because of the mucus plug, right? What will happen is that the partial pressure of carbon dioxide will keep on increasing here. Why? Because the blood is bringing more and more carbon dioxide along with it. From where? From the tissues, from the cells, from where the oxidation is going on, right? Where the metabolism is going on, carbon dioxide is being produced. It's going to come here and it's going to diffuse into the alveoli and going to get accumulated there, which will result in decreased partial pressure of alveolar oxygen. Capital A is for alveolar, small a is for arterial, right? So this decrease in partial pressure of alveolar oxygen will result in decreased diffusion gradient between the alveoli and the oxygen that we have in the blood, because there has to be some difference between their values so that there will be increased rate of diffusion. But because the value has decreased, as we can see here, of the partial pressure of alveolar oxygen, the diffusion will not be that vigorous, which will create a condition of hypoxemia in blood. As we can see here, hypoxemia because of the less atrial oxygen, right? So that is, hypoxemia is basically less oxygen in blood, right? Now what is cyanosis? Cyanosis is basically bluish discoloration of the skin and the mucous membrane. It can be seen peripherally as well as centrally, and centrally it's seen on the lips, the tongue, the buccal, and peripherally it can be seen on the nail beds, in the palms and soles, and even on the earlobes it can be seen, right? So it's the bluish discoloration of the skin and the mucous membrane. Why? Because of the increase in the number of deoxygenated blood. As we can see, because of the hypoxemia, the deoxygenated blood, the deoxygenated hemoglobin will not be able to saturate themselves with oxygen because there is reduced oxygen, right? So they won't be able to saturate themselves with oxygen, which will lead to increased deoxygenated hemoglobin, which will be manifested as cyanosis. Now, talking about infection, whenever we block a tube in a body, there is increased chance of getting infection just behind the tube. As we can see here, if the bronchial tree is blocked anywhere, there will be increased chances of getting infection behind that tube. Cor pulmonale is basically talking about let me just tell you about this idea of hypoxic vasoconstriction, right? Hypoxic vasoconstriction is basically whenever an alveoli is less ventilated, such as in condition of hypoxia, such as in condition as hypoxia, right? What will happen is that vessel that is supplying that alveoli will vasoconstrict and shunt the blood to somewhere else where there is good supply of oxygen. Okay, a well ventilated alveoli, it will supply the blood there, right? So this is basically called as hypoxic vasoconstriction. Now here what's happening is there's hypoxia in almost all of the alveoli because of the mucus plug formation is happening in all the alveoli almost, right? So because of this, all the pulmonary vessels will vasoconstrict, trying to shunt the blood where they don't even know. They just want to shunt it not to that place. They know it because this alveoli is not well ventilated. Let's shunt it to somewhere else. But where? There are no alveoli left because all of them are mucus. All of them are basically blocked with the mucus plug, right? So what's going to happen is that here we have the right atria, right ventricle, left atria, left ventricle of the heart, and there's increased pressure in the pulmonary vessels, which will be seen in the right heart as well, which will lead to increased blood pressure in the right heart, especially in the right ventricle, which will result in right ventricular hypertrophy, and that will even result in heart failure. I hope I was clear with this, and I'm done revising my chronic bronchitis. Thank you for being a part of it.